Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. Now, there's only one muscle that attaches on the patella, and that's the quadriceps muscle, quadriceps femoris. That makes the quads a really good target for conservative interventions, meaning therapeutic exercise, to attempt to stabilize the patella in position. We're not going to do much by messing with ligaments, right? And if there's a muscle that doesn't attach on the patella, it won't have as much of an effect on the patella's position. And so most of these patellar stabilization exercises in some form or fashion are going to involve strengthening of the quads, in particular with isometric exercises. And there's a lot of different ones that we'll cover in this video, like the quad set, straight leg raise, sidelying hip abduction, prone hip extension. And then we can progress to moving the knee through a small range of motion while still strengthening it. And that would be something like a Theraband-Resisted terminal knee extension. We'll be covering all 5 of these here in this video, and understand that these are not the only exercises you can use, but when done correctly, as I will demonstrate, these are excellent for patellar stabilization. In this video, I'm going to demonstrate and discuss some exercises that are useful for patellar stabilization. Patellar stabilization is a treatment approach that can be used in the conservative care of patellar subluxations. And if you want more information on patellar subluxations and dislocations, you can find the full video on my channel, which also includes these exercises as well. Now, before we get into the TherEx, let's look over here on the left side of the screen at this knee brace. This is a soft knee brace called a donut brace that still allows the knee to move through flexion and extension range of motion. But it has this hole here in the center. And around that hole, the circumference of it, this is the donut. And it's a thicker, more reinforced part of the brace, so it's a little bit tougher, more durable and stable. And so by wrapping this donut around the patella, around the kneecap, it essentially helps to hold the patella in place and prevents it from subluxing, normally laterally. Remember, that's the most common direction, although it could sublux medially. And so this provides a temporary solution to patellar subluxation. But the problem with a brace like this is it's not a permanent solution. You could certainly wear this the rest of your life, but it doesn't fix the underlying problem. And so rather than jumping straight to surgery, sometimes they'll try conservative care, basically exercises to try and fix the problem and see if that helps to avoid surgery. The first 4 here are exercises that target the quadriceps isometrically at the knee joint. You may have other movements at the hip joint, like hip flexion in a straight leg raise, or hip abduction or hip extension, but in terms of the knee joint, the quad is activated isometrically, and that's typically how you'll start a patellar stabilization therapy. Once those become a little bit easy and you've got a little more stabilization in the knee, you can progress normally to smaller range of motions. And a good example of that would be Theraband-Resisted terminal knee extensions, which we'll show at the end of the video. So let's get into these. The straight leg raise is an excellent exercise to strengthen the quadricep muscles, especially in 3 cases or some combination of them. Number 1, if the patient's pain is very severe or irritable. Number 2, if the patient is not permitted to weight bear on the given lower extremity. And number 3, if the patient can only move through a small range of motion at the knee joint. But before you teach a straight leg raise exercise, the patient should probably understand a quad set, which is a very useful exercise for activating the quad muscle. Now, the quad set is not just a simple contraction of the quadriceps femoris muscle. A correct quad set requires dorsiflexion of the ankle, and that dorsiflexion should be held throughout the duration of the quadriceps contraction. So you'll see that right here. So step 1 is dorsiflexion of the ankle, which you see right there. Then I contract my quadriceps, and I'm going to maintain that contraction for around 10 seconds. Once I've held that contraction for 10 seconds, I can then relax and reset like you see right there. And a typical rest period might be 10 seconds. So 10 seconds contracted, 10 seconds off. So there I'm dorsiflexing my ankle and contracting the quadriceps right there. And you'll notice for that full 10 seconds, not only am I maintaining quadriceps contraction, I'm also maintaining ankle dorsiflexion. But before you teach a straight leg raise, the patient really should know how to do a quad set. Once they understand that, you can progress to teaching the straight leg raise exercise. Now, the straight leg raise exercise is different than the straight leg raise test used to rule down a lumbar radiculopathy. The straight leg raise test is passive, meaning the practitioner passively moves the patient's leg up. The straight leg raise exercise involves the patient using their own muscles. Now, while the quad set only utilizes the quad muscles right here because it's an isometric exercise, the straight leg raise exercise is also going to use the iliopsoas muscle group, psoas major and iliacus, in addition to the quadriceps. And the straight leg raise exercise is done exactly the same way as the quad set, except instead of being isometric, we're also going to raise the leg up. So let's take a look at that right here. So here I am in the supine position. I'm going to start by dorsiflexing that ankle, contracting the quads, and holding both of those. I'm going to elevate the thigh at the hip joint. In other words, hip flexion. That's the straight leg raise. And I'm going to hold it there for a number of seconds. And then I'm going to slowly lower the thigh back down to the table while I'm maintaining dorsiflexion and quad contraction. In other words, knee extension. So there's dorsiflexion, quad contraction, and I raise it up. The entire time that leg is in the air, I am maintaining that quad contraction and ankle dorsiflexion. Once I bring that back to the table or the ground, I can then relax and reset. Again, the straight leg raise exercise is done exactly the same as the quad set. Ankle dorsiflexion, quadricep contraction, except now you're raising the leg up. And because you're raising the leg up, you're utilizing the hip flexors. The rectus femoris is the only quad muscle that is a hip flexor, but again, we're also utilizing some of iliacus and psoas major, the iliopsoas muscle group. However, the entirety of the quadriceps are also used because they are contracting to draw that patella up towards the hip, that superior glide force on the patella. So again, the straight leg raise exercise is a progression of the quad set and works the quadriceps even more than the quad set alone. The exercise we're going to look at here is sidelying hip abduction. This is an excellent exercise for strengthening the hip abductors, as you might expect. And those would be gluteus medius, gluteus minimus, and also the TFL, tensor fascia lata. Now, if you go back to the video where we cover the quad set and the straight leg raise, you'll actually see that the beginning steps of this exercise are done exactly the same way. So step one is ankle dorsiflexion, which you'll see here in the video in a minute. Once we've dorsiflexed the ankle, we hold that and then contract the quadriceps, so straighten the knee as much as you can as a cue you can give a patient. And then, while maintaining both of those, ankle dorsiflexion and knee extension through quad contraction, then we'll elevate the thigh at the hip joint into abduction. So let's take a look at that. So here I am in side lying. There you see ankle dorsiflexion and then quad contraction and maintaining both of those. Then I'm going to elevate the thigh at the hip joint. And you'll notice that when I bring that to the top, I hold it there for a couple of seconds. So ankle dorsiflexion, quad contraction, bring that up into hip abduction, hold for 2 to 3 seconds, and then bring it back down. And once I bring that back down, I can relax and reset. I don't have to necessarily hold the dorsiflexion and quad contraction the entire time, although you can. The other thing to notice here is that that ankle dorsiflexion and quad contraction are maintained the entire time that that hip is in the air. And they're only released once that thigh comes back down to the floor or the table, depending. Okay? Now we're going to cover prone hip extension. Obviously, if we're doing hip extension, the main muscles we're going to be working are the gluteus maximus, shown here in green. That's the major hip extensor. But of course, we also have the hamstring muscles. So right here we have semitendinosus. This would be semimembranosus, a little bit deep to that. And then the lateral muscle, biceps femoris. Now, when we do a prone hip extension, we're going to begin this exactly the same way that we did quad sets and straight leg raises, and also side-lying hip abduction. So you'll see this in a second in the video, but we want to first dorsiflex the ankle and hold that, and then contract the quadriceps while maintaining ankle dorsiflexion. And so while maintaining both of those, we're going to extend the thigh at the hip joint. So you'll see that here. So there's ankle dorsiflexion, quad contraction, and while maintaining both of those, I go into hip extension like that. Hold it up top for a few seconds, and then slowly bring back down in a controlled manner. And then I can relax and reset. And then again, the second rep, ankle dorsiflexion, quad contraction, and then hip extension. You'll notice the entire time, again, that thigh is in the air. I'm maintaining quad contraction and ankle dorsiflexion. I don't relax those until the leg has returned to the starting position on the table or the floor. Now, when you're doing prone hip extension, you'll probably want to have the feet dangling off the edge, because if the feet are still on the table, it's going to be a little bit difficult to dorsiflex the ankle, but that's something easy to fix. Assuming these isometric exercises have helped stabilize that patella, we may begin to progress into a small range of motion near full extension, and these would be Theraband-resisted terminal knee extensions. Let's look at these now. Theraband-resisted terminal knee extension is obviously not an isometric exercise, as you'll see in just a minute, but you want to begin by having the Theraband or some other kind of elastic band wrapped around the back of the calf, below the popliteal area on the back of the knee. Now, once you have the Theraband in place, there's two ways you can do this exercise. You can either do the same thing with both knees, so both knees begin flexed and then go through terminal extension, or as we'll see in just a minute, you can actually just go through slight flexion and extension of the treatment knee. In this case, my left knee is the treatment knee because the Theraband's wrapped only around that one. Let's look at the first way first. So again, we're going to begin with both knees flexed at about 10 to 20 degrees of knee flexion. And as you can see there, I'm just going into terminal knee extension. And after I go into each terminal knee extension, then we rebend the knees back to the start position. And obviously here I'm doing the same thing with both knees, even though it's only the left knee being treated, because only the left knee has a Theraband around it. Okay? The other way you can do this is by just extending the treatment knee. So as you see there, my right knee is staying in that flexed position. And now I'm taking the left knee from that flexed position to terminal knee extension. In both of these cases, the knee doesn't need to go beyond 20 degrees and definitely doesn't need to go past 30. So a good range would be anywhere between 10 to 20 degrees of flexion. So it's a pretty small range of motion. So that is the Theraband-resisted terminal knee extension. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.